Good morning, everyone. I'm Kana Ishikawa from Kobe, Japan. It's a great honor for me to make a presentation today. My topic is risk factors for postoperative abscess formation in patients with upper gastrointestinal perforation. I have no financial relationships to disclose. A regional abscess is a common complication after surgery for usual perforation, which prolongs the duration of antibiotic therapy and hospitalization. So it is something that both patients and we want to avoid. However, risk factors for abscess formation have never been investigated. The purposes of our study are to identify predictive factors of postoperative abscess formation in patients with usual perforation, and to discuss if we have any additional cures during and after the surgery for the prevention. This is a single institutional retrospective study. We included 75 patients who were diagnosed with usual perforation and underwent surgery from 2015 to 2022. Multivariable logistic regression analysis was used to determine independent risk factors for abscess formation. Among 75 patients, 22 patients had abscess formation. More than 90% of the perforation were caused by benign ulcers, and more than half were due to duodenal perforation. 92% of cases were treated by laparoscopic approach. When dividing into two groups, the group with abscess formation had more patients with older age, ongoing chemotherapy, larger perforation size, poor renal function, and a higher level of CRP. There was also a significant difference in operative time. Nearly half of the patients were hospitalized for less than 14 days after surgery, and the rest had to stay more than 2 weeks. In addition to regional abscesses, other complications include retrograde infection via drainage tube, pneumonia, and ileus. From these results, we extracted 4 variables as potential risk factors and performed a multivariate analysis. The analysis shows that advanced age, current history of cancer chemotherapy, and large perforation site were risk factors for regional abscess formation. Now, let's do the discussion. Here we raise 2 questions. The first one is that why patients with these factors are more likely to form regional abscesses? We attributed this to the fact that elderly patients and patients undergoing chemotherapy are often undernourished and have weakened immune function. Because of this negative nature, they might be vulnerable to infections and need longer time for wound healing. Besides, it shows that large perforation size often lead to severe intra-abdominal contamination, prolonged operative time, and incomplete sutures. Therefore, more meticulous operation and close observation are required to reduce the abscess formation or detect the complication quicker. Again, this is our conclusion. Advanced age, cancer chemotherapy, and perforation size were risk factors for postoperative abscess formation. Thank you very much.